When I was a young boy, a surgeon told my mom that my grandfather would die without surgery the next day, and he lived for the next 20 years. The impact that a single human being can have on another human being so impressed me. That was my driving motivation to go into the field of medicine. I became involved in chordoma research in my first few years in practice. Chordoma is a primary bone tumor that occurs in the central skeleton. One challenge in chordoma is the low incidence of the disease, which is about 1 in a million. Because of the low incidence, there's been few studies that have actually focused on chordoma. For example, there's over several thousand FDA-approved agents, and there's only been a few that have been tested in clinical trials for patients with chordoma. Our research focuses on trying to understand the disease entity and taking that knowledge and translating that into therapies for patients. The conditions required include establishment of better preclinical model systems, in vitro and in vivo testing of therapeutics, and well-designed human clinical trials. The Chordoma Foundation has been instrumental in accelerating finding a cure for chordoma. They have dramatically increased awareness of this disease, established international and national collaborations between scientists and clinicians. And that led to a collaboration between us and NIH that was fostered by the Chordoma Foundation that rapidly accelerated our research here. Not only do they directly provide funding for our group and many other institutions, but they've enabled indirectly for researchers to get access to more funding that's outside of the Chordoma Foundation. I'm a firm believer that people do more when they work together than when they work in individual silos, and the Chordoma Foundation fosters and accelerates that process. One unique aspect about my life is that my wife is actually a translational oncologist as well, and we do collaborate together on chordoma, and we get the benefit of having each other's experience and critical eyes on data. The prospects for our research are quite promising. We've identified several exciting drugs that slow the growth of chordoma in our model system, and I think it's really not a matter of if there'll be a cure for chordoma, but when there'll be a cure for chordoma.